So for your laboratory evaluation 1, now you have hemoglobin and hematocrit. Okay? So for hemoglobin determination, you do have various methods in being used in determining your hemoglobin method. First, you have copper sulfate or specific gravity method. This is being done is a quick review of your hemoglobin content of the RBC. So how it is done? You will use a solution of copper sulfate. Okay, copper sulfate, no, it is a blue solution, yung blue solution. Then you will just drop blood. Okay, using a finger prick, you will drop a blood. Usually we use this in mass blood donation, no, to assess quick your specific gravity, your hemoglobin using the specific gravity. If so for example, you have the solution. So you do have the solution, no? It has a copper sulfate, yeah. Then the drop of blood. If ever the blood will sink, okay? If ever the blood will sink, then you do have enough hemoglobin in that patient. If it floats, then you don't have enough hemoglobin. Mababa masyado yung hemoglobin content. Okay? So, your patient cannot donate blood. Okay? That's the quick method in determining hemoglobin if there is a normal hemoglobin or decrease or increase amount of hemoglobin. Next is your gasometric method. Okay? This is a oxygen capacity method. The principle will be your hemoglobin will combine and liberate a fixed quantity of oxygen. The blood is hemolyzed with saponin, and then the gas is collected and measured in Van Sky apparatus. So, your blood will be hemolyzed, okay, to release the hemoglobin content inside the cell. Okay, first we will hemolyze the blood. Then, the hemoglobin, no, binded with the oxygen, will release the oxygen. Okay, then the oxygen is measured using the Van Slyke apparatus. Then the greater the oxygen content or the greater the oxygen that you tested, then the hemoglobin is greater. Because no, the greater hemoglobin, the higher oxygen concentration in the blood. Okay. Next is the chemical method using your iron content method. So we evaluate your hemoglobin using the iron content. Okay, iron is also binded to your hemoglobin. Okay? Then the colorimetric method using visual, no, direct matching, acid hematine, and alkali hematine. So we use usually your acid hematine on your um, hemoglobin determination, even direct matching. No? You already done this on the laboratory. Okay, okay by fire. So yung acid hematine, no, using chemicals like your acid hematine is your hydrochloric acid, okay, to the to hemolyze the blood, then you use distilled water to equivalent it with the comparator black. Same principle with the alkali hematine and direct matching. Okay? Your chemical method naman, you dissociate your RBC, then check for the iron content of the blood, no? Like your oxygen, it is counted. Now, the iron is counted, then correlates with the hemoglobin content of the RBC. You have next is your photoelectric. Okay, your photoelectric method, usually this uses no spectrophotometry or photometry. Okay, to have desired hemoglobin content of your blood. Okay, to check the desired hemoglobin content of your blood. So first you do have oxyhemoglobin method. It uses it measures the plasma hemoglobin. Okay, oxyhemoglobin. Usually this is the normal hemoglobin found in your blood. Okay, the normal hemoglobin is measured, okay, using your photoelectric. Okay, then you have the method, okay, standard and reference method being used in measuring hemoglobin. Okay, How do we do this? No, you dissociate, or you use reagent like your Drabkin's reagent. Okay, your Drabkin's reagent is composed of your potassium pericyanide, your potassium cyanide, okay, and other components of it, not to bind the hemoglobin, to convert it to a methemoglobin, then to be analyzed it as the methemoglobin. Okay, sulfhemoglobin is not converted into cyan methemoglobin, thus cannot be measured, no, in your cyan meth. Okay, if ever that the patient has a sulfhemoglobin in the blood, this can affect the reading and decrease, no, the hemoglobin content of your patient. Okay. While your direct methods no uses comparators, no, which cannot distinguish your hemoglobins. On your on this acid hematine alkali direct matching, no, this read sulfhemoglobin, cannot read sulfhemoglobin, fetal hemoglobin, methemoglobin, and even sickle cells. Okay, they cannot identify those or correlate those. Okay? Oh, in yung cyan met, no? The blood is diluted in a solution of potassium ferricyanide and potassium cyanide. Then the hemoglobin is oxidized to form methemoglobin. Okay. The methemoglobin by the potassium ferricyanide, no, then converts the methemoglobin to cyan methemoglobin. No? The cyanide converts the methemoglobin to cyan methemoglobin. Then the absorbance is measured in 540 nanometers using your spectrophotometer. Okay, 500 nanometers. Doon lang nababasa si cyan methemoglobin. Okay, ito yung formula nasa baba. Your hemoglobin is combined with potassium pericyanide to convert your hemoglobin to your methemoglobin. Then, your methemoglobin is now, no, added with your potassium cyanide, thus converting it to cyan methemoglobin, which is measured for 500 nanometer. Okay? So, in that method, you use Drabkin's reagent. Okay? It is a pale and yellow with a pH of 7 to 7.2 with deviation of 0.2. Anong ibig sabihin ng deviation? It's either 7.0 to 7.4 plus minus. Okay? The specimen that should be used is EDTA or ethylene in EDTA, whole blood. Okay? Reference range 14 to 18 gram per deciliter for male, and for female is 12 to 15. Okay, mas mataas ang male for higher hemoglobin content of the RBC is found, and higher RBC count is found in your male patients. Okay, factors that affect the hemoglobin result. First is your age. Your age can affect the hemoglobin content for the production of the blood. Production of the blood. Okay, the older the person gets, no, the less blood cells that they are being produced. Okay? Nagkakaroon tayo ng decline in blood cell production. Next is sex, no? As seen, males has a larger hemoglobin content than female. Why? Because of the RBCs. RBC counts are higher in male than the female. That's why hemoglobin is higher than male in male. Okay? Then the altitude and location, okay, for the binding of your hemoglobin. Okay, this can affect, no? Higher altitude has higher hemoglobin. Bakit? Higher altitude has a lesser oxygen. That's why you need higher hemoglobin to bind that oxygen in your RBC. Okay? Lower altitude has a higher oxygen. That's why you don't need higher hemoglobin to bind with that oxygen because the oxygen is abundant. Okay? So that's how your altitude affects the hemoglobin content. Okay. The content of your modified drug kins, no? Yan. Sodium bicarbonate, potassium pericyanide, potassium cyanide, and distilled water. Okay. This can also um, provide us with a background on the patient, especially in uh, color of the content of the hemoglobin. So for him, hyperchromia or hyperchromasia, increased hemoglobin. Okay, the cell is darker than it looks like. Okay, this is seen in polycythemia vera, no increase RBCs, okay, and plasma viscosity. Then dehydration, bakit? Your water content of your RBCs are being removed. Thus the hemoglobin content is being increased. Then changes from high to low altitude. Okay, oligochromia, decrease in hemoglobin level. This is also found in your anemias. Okay. Okay, you have sources of error in doing your cyan-met hemoglobin method. And what are those? Okay, your Drobkin's reagent is sensitive to light. Thus, it should be stored in a light protected container. Kaya nandun siya sa amber colored bottle. Okay? Then, ayan, correction for that, it should be stored in a proper place, especially in a brown or light sensitive bottle. Okay, another source of error, increase in WBC and platelet count, which causes high turbidity in the spectrophotometry. Okay? Your high turbidity can affect the spectrophotometry, thus increasing the hemoglobin. Okay? This is being corrected using decentrifugation. No? Then, light mimic samples can also interfere. How? No? Because of the turbidity also. Next is the hemoglobin SNC because this is a source of error because of their resistant to the hemolysis causing turbidity again. Okay? Your spectrophotometry is sensitive to other interference in their turbidity. Okay. Correction for this hemoglobin SNC. You dilute your sample using distilled water of the ratio of 1 is to 2. So one drop of your sample, then 2 drops of your distilled water. Okay? Then abnormal globins found in multiple myeloma or Waldenstrom macroglobulinemia may precipitate. No? Precipitate can also cause turbidity in your sample, thus causing increased hemoglobin content in reading using your spectrophotometry. Okay? Correction for this is add zero point 0.1 gram of potassium carbonate to the Dropkin's reagent to release those authorize those abnormal globins found in that sample. Okay. Your hemoglobins is being used to screen for diseases, especially associated with your anemia. Okay, this also affects the severity of your anemia. Okay, this can also be used to follow up the response for the treatment for anemia, especially those patient who has a medication for anemia. Okay? Check natin kung okay na ba yung hemoglobin content ng mga patient natin. Okay? This can also evaluate polycythemia in patients. Next is decreased hemoglobin level. Now um this is being seen in patients especially with anemias. Okay, decreased blood component or red blood cell component. Okay? Like your iron deficiency, thalassemia, pernicious, okay? Liver diseases, hypothyroidism, hemorrhage. Okay, this can also decrease the hemoglobin content. Okay, hemolytic anemias caused by transfusion incompatible blood, reaction to chemical or drugs, reaction to infectious agents can also decrease the hemoglobin level. How? So, transfusion of incompatible blood can cause hemolysis. Okay? Can cause hemolysis, thus decreases your hemoglobin. Same goes with your chemical and infectious agent. Okay? And various systemic diseases can also decrease your hemoglobin level, like your Hodgkin's diseases, leukemia, lymphoma, and your systemic lupus erythematosus. There is also increased hemoglobin level found in your polycythemia vera. Okay, this is a increased blood or an overload of blood cells, especially in RBC. Ano? Chronic heart failure can manifest increased hemoglobin content, and chronic obstructive pulmonary disease can also manifest high hemoglobin content. Bakit? In these two, the oxygen level of the patient is decreased. Thus, the body is increasing the hemoglobin level found in the RBC to bind more oxygen for the patient. Okay? Variation in hemoglobin levels occurs after transfusion, hemorrhage, burns. Thus, your body is compensating with the defects now being inflicted to your blood. Okay. You do have interfering factors for your hemoglobin. Okay, so we have the altitude, no? Sinasabi na kanina. High intake of fluids can decrease hemoglobin. Why? Your blood is being diluted. Okay, yun lang yan. The blood is being diluted in the high fluid intake or excess fluid intake. Normally, the hemoglobin is higher in infants because of their other production of blood cells. Okay, they are actively producing blood cells. Thus, their hemoglobin is high. Okay, for the purpose of that, and also for their oxygen requirement. Then some of the drugs can interfere your hemoglobin content, especially those drugs na dealing with your that causes anemia. Some of the drugs can cause anemia. Okay? Hemoglobin is normally decreased during pregnancy because two persons are using your blood system. Okay? Kaya decrease sa pregnancy ang yung hemoglobin and also correlates with your hematocrit. Okay, the clinical alert for your hemoglobin is less than 5 grams per deciliter. Okay, this can cause heart failure and death to a patient. Okay, less than that can cause cardiogenic shock. Okay, when you say cardiogenic shock, konti na lang yung nagpo-flow na blood, thus decrease yung oxygen content of your blood, no, leading to ischemia. Thus, further will go to your heart failure. Okay. Then value more than 20 grams per deciliter can lead to clogging of capillaries as the result of hemoconcentration. Okay, increased value naman for your hemoglobin can cause clogging or clotting of your bloods that can obstruct the capillaries. Okay. Next is your hematocrit determination. No, this is the PAC RBCs. Okay? This is usually used in evaluating the RBC content of the blood per a volume of your whole blood. No? The principle is the anticoagulated blood is centrifuge and the total volume of the red blood cell mass is expressed in percentage or decimal fraction. Okay? So you do have methods also. You do have macro methods. Okay, using your Weintraub tube. Okay. Hayden's modification method, Van Allen methods. Okay. This uses your different anticoagulants like your double oxalate, 1%, 1.1% sodium citrate, and 1.6 sodium citrate. Yan lang yung pinagkaiba-iba nila. Okay? Then you do have Sanford's maggot method, 1.3% sodium citrate, and Brace method using your heparin as anticoagulant. Okay. How we differentiate your macro and micro? Okay. Blood collection. Usually, your macro method utilizes venipuncture while your micro method uses skin or venipuncture. Okay? Next, amount of blood, mas malaki syempre for macro method, for the tube is larger, no? Like your Weintraub tube. Unlike your micro method, it utilizes only your capillary tube. Then, the rotation of your centrifuge, mas mabagal on your macro method, thus, no longer yung time of centrifugation. While your micro method only utilizes 10 to 12,000 RPM. Kaya mas mabilis yung time niya in reading the micro method. Then simplicity of the technique. Siyempre, macro method is technical, more harder than the micro method. Okay, on macro method, ESR can be performed. Why? It has a graduation. No, your tubes used in macro method has graduation, thus ESR can be evaluated. Micro method cannot perform ESR. Bakit? Kasi it's too small, the blood is too small, and the phases of your agglomeration cannot be performed. Okay? Spilling and leakage, not common in macro method. Why? The glass are thicker. Okay? The glass are thicker being used in the tubes. Unlike your macro method, no commonly yung spillage and leakage. Bakit? Manipis masyado yung capillary tubes. Okay, breakage of bumpy coat, not common in macro method because of the stabilization of your blood in the tube. Common siya sa micro. Bakit? Because of the fragility of your capillary tube. Okay. Separation of bumpy coat, complete in macro method. Why? Settling of your cells are completely done. Unlike your micro method, the tube is too small, such as interference of your buffy coat. No separation of buffy coat can occur. Then cost of apparatus, syempre, more expensive on the macro method, cheaper on the micro method. You do have normal values. No, woman, 35 to 49%. Men is 42 to 54. Higher pa rin, no, because of the RBC content of the patient. Okay, clinical implications. Decreased values can be seen in anemia, such as your leukemia, lymphomas, adrenal insufficiency, chronic diseases, and acute and chronic blood loss. Hematocrit may also not be reliable immediate after even the moderate loss of blood or immediate transfusion. That's why, no, after transfusion and even in blood loss, no, inuulit natin yung hematocrit counting or your RBC checking. Bakit? Kasi hindi agad-agad bumabagsak or umaakyat yung hematocrit on those patients. Okay, increased hematocrit value occurs in erythrocytosis, polycythemia vera, and shock, considering the hemoconcentration. Okay, Why? Because this diseases, okay, inflicts high RBC count. Okay? Thus, the hematocrit is increased. Why? Because your hematocrit is the packed RBC. Kaya, it correlates with the amount of your RBCs. Okay. The interfering factor, same as your hemoglobin, it has in high altitude. Okay. Normal values vary from age and gender. Lower values in men and women older than 60 years old. Why? Because of the production of cells. Okay, severe dehydration from any cause falsely raises the hematocrit because of decreased plasma volume. Sources error in hematocrit determination, the speed and duration of centrifugation. Okay, slow. Okay, centrifugation will falsely increase your hematocrit. Okay, too long or too speedy, centrifugation can decrease the hematocrit content. Thus, we do have a specific, no, time and speed for your hematocrit method. Okay. Then the types of amount of anticoagulant being used in your hematocrit, no, shrinkage and um, swelling of the cells can affect the hematocrit concentration or determination. Okay, two large cells can have higher hematocrit method. Now, two small cells can decrease hematocrit method. Integrity and length of diameter of the tube can also affect the hematocrit determination. Thus, the macro and micro has a difference in the procedure. Okay, error in sample, improper techniques in blood collection and capillary blood, failure to mix the blood properly before sampling, leakage of blood in case of microhematocrit, okay, improper sealing, okay, errors in taking and reading the calculate and calculating the result. So that's the human error. So in hemocytometry, okay, we evaluate or we count the cells found in the blood. Okay, we do have RBC, WBC, and platelet counting. Okay, so using hemocytometer or a counting chamber, macroscopically, it is composed of two raised surface. This is the two raised surface. And then a shape of H, which has a 3 by 3 millimeter squared separated by in shape. So, found in here. Okay? The total area is 9 squared meters. Each of the square here is a 9 square meter. Okay? So, microscopically, your hemocytometer looks like this. Okay? Now, one large square is made up of 1 millimeter per 1 millimeter squared. So, this one is 1 millimeter per 1 millimeter. Okay? This is used in WBC counting. So, let's put W there. This is used for WBC counting. While your center is subdivided into 25 smaller squares, which is 1, 2, okay. Makikita. So, 1, 2, 3, 4, 5. Okay? Those areas you will note with the RBC and platelet counting. Okay? The diameter of that is 0.10 millimeter. Sorry. That's the depth. Sorry. That's the depth of the cover slip and the between the cover slip and the counting chamber. Okay? Okay, general formula being used, no? Cell counted times the dilution factor over the area in millimeter squared times the depth. Okay? Or, you can use the total cells is equivalent to cells counted times dilution factor times 10 over the area millimeter squared. Okay? Okay, use the battlement method in reading the cells. Okay, and you should be using your low power magnification. Okay, so battlement. Okay, then the ruling. You do have the rules in reading. No, all cells at the top and left corner are counted, while your bottom corner and right corner will not have a count. Okay, for you not to have a doubling cells in counting. Okay, WBC count, no, represents the RWBC found in a 1 liter of full blood. Formula, same nun sa general formula natin. The variables are the dilution, 20. 1 is to 20 ang dilution that is found in your WBC pipette. No? The area counted is 4. For the 4 large cells are counted in the hemocytometer. Then the depth is 0.1, which is constant. Okay? The SI unit being used is 10 raised to 9 per liter. Okay, we use diluting fluid such as your glacial acetic acid, 2 to 2%, 2 to 3%, 1% hydrochloric acid with 1 drop of methylene violet or crystal violet. Okay, criteria for good WBC diluting fluid. It should be hypotonic. Okay? Bakit? To lyse your RBC. No? The hypotonic solution lyses your RBC, which your WBC is remained unharmed. Okay? It should color, no, or stain the nuclei of your WBC to differentiate from the RBC. Okay, reference range is 4.5 to 11.5 times 10 raised to 9 per liter. Malapit ito. Okay, corrected WBC count. So you have a corrected WBC count for some interference of your NRBCs or nucleated RBCs. Okay, more than 5 nucleated RBCs found in your smear can affect the counting of WBCs because of the it resists hemolysis in hypotonic solution, and it is being stained. That the nucleus of the NRBCs are being stained. Okay, thus you can count them as WBC in counting chamber. Okay, the corrected formula for this, no, is equals to uncorrected WBC count times 100 over number of your NRBCs per 100 WBC plus 100. Okay? Then your red blood cell count, same formula generally. Okay, the area factor is 5. Why? The 5 center small square are being counted. The depth correction factor is 10 and the dilution factor is 200, which is seen in your RBC pipette. Okay? The RBC count, no? Number of cells counted times 5 times 10 times 200, or number of cells counted times 10,000. Kasi this is equivalent to 10,000. SI unit for this is 10 raised to 12 per liter. Okay, reference range for your RBC count is 4.6 to 6.0 times 10 raised to 12 per liter in male, while for female, 4.5 to 5.4. Okay? So, different diluting fluids are also available for your RBC counting, like your Hyams, Gower, Toysons, no, Daisies, Bethels, NSS or salt solution, and then your sodium citrate, 3.8%. Okay. So for your dilution fluids, no, Daisies fluid or formal citrate is the best diluent considered for RBC counting. It keeps for a longer time and does not alter the shape of the cell. Okay? It is composed of 40% formaldehyde and 3% weight per volume disodium citrate. Next is your Hyams fluid, na composed of your mercuric chloride and sodium sulfate anhydrous. Gower solution prevents Rolu formation. How? Because it contains, no, sodium sulfate anhydrous, glacial acetic acid, and distilled water. Okay, no Rolu formation is being formed using your Gower solution. Toyson's fluid, high specific gravity, and stains the WBC, thus differentiating your RBCs and WBCs. Okay, it is composed of sodium chloride and sodium sulfide, no? Glycerin and methyl violet and distilled water. Then you have NSS, no? Used in emergency cases, used in the presence of rolupermation and anticoagulation of cells. It is composed of your sodium chloride 0.85 and distilled water, which will provide you 0.85% NSS, which is the normal body. Okay, 3.8 sodium citrate can also be used as your diluting fluid for RBC, which is composed of sodium citrate and distilled water. Okay, criteria for good RBC diluting fluid, it should be isotonic. For your RBCs are sensitive for the tonicity of the solution. Okay, it should have also a good preservative, then does not initiate the growth of molds and yeast, with a high specific gravity, with buffer action, and cheap and easy to prepare. Okay, in using CBC, no, we do have rule of three. What is the rule of three? The value of hematocrit should be 3 times the value of hemoglobin, plus minus 3. This rule applies only the specimen have normochromic and normocytic erythrocytes. So how do you do that? So your hematocrit times 3 is equals to your hemoglobin. Your hemoglobin times 3 is equals to your RBC count. So that's the rule of 3. Okay, your RBC count divided by 3 is equals to your hemoglobin. Hemoglobin divided by 3 is equals to your hematocrit. So that's the rule of 3. Okay, that ends our lecture. So do you have any question?